Hello, everybody. So today I want to talk to you and take you on a journey into the world of professional communication with a special focus on the unique aspects of working with Japanese patients in the field of occupational therapy. Um, as a healthcare professional, it is crucial for us to understand and respect cultural nuances to provide the highest level of care. So let us dive deep into the behaviors and practices that can truly make a difference in our interactions and contributions um, for positive therapeutic outcomes. Um, so let us begin with one thing that seems like innocuous, something that we probably think is the same maybe across the whole world, and that is counting. Um, in Japanese culture, counting goes beyond just numbers and encompasses symbolism and gestures. It is important to note that traditionally the Japanese use symbolic finger closures to represent numbers. For instance, a closed thumb signifies one. So this would signify one, as opposed to maybe here we're used to doing this as one, right? So this would be one in the US, but when working with the Japanese patient, we would want to go like this. So the closed number, the closed um, finger, sorry, is the one that represents the number. So this would be one, this would be two, this would be three, four, and five, right? So as opposed to one, two, three, four, five, we would go one, two, three, four, five, with a closed fist representing five. Um, However, it is also worth mentioning that the practice of using raised fingers to indicate numbers is becoming more prevalent. So you may see with younger Japanese people, they may go count like this, like how we do it, one, two, three, four, five. Um, so maybe practice with them initially. You can ask them to say, okay, put up one. How would you say one with your fingers? How would you say two with your fingers? So you get an idea of how they count. Um, Understanding this cultural aspects enables us to communicate effectively with our Japanese patients, avoiding any potential misunderstandings, and strengthening the therapeutic bond that we have. For example, if we had a patient who had a TBI and we needed to do an assessment that includes counting, we want to make sure we are doing it the right way. If we did it the Western way or the American way, we may be giving the patient the wrong information. Okay, the next thing I'm going to be talking about is beckoning. Um, so let us explore the concept of beckoning, which means calling someone over. So in Japanese culture, when we want to invite someone to approach or come closer, there's a specific gesture involved. It entails facing the palm of the hand downward and gently moving and waving the fingers toward one's body, like this. So not like this, how maybe we're used to doing it like this, like, hey, come here, come here. Um, it's much more polite to do it this way with them. Um, as an occupational therapy professional, incorporating this gesture when encouraging patients to ambulate, for example, um, demonstrates cultural sensitivity and it fosters a comfortable and inclusive environment where patients feel understood and respected. In occupational therapy, when we have the patient ambulate to us, instead of doing the normal American come here gesture, it would be a good idea to do the Japanese version. So if you have a patient at a skilled nursing facility with a TBI, right? So like, um, and you're working on ambulation, and you want them to come towards you with their walker, you would be preferable when dealing with Japanese patients to do it this way. You can be like, come here, can you come to me instead of going this way? Another thing I want to talk about is um, expressing emotion. In Japanese communication, there exists a cultural norm of refraining from displaying intense emotions, especially in formal settings such as a clinical setting, workplace, or educational environment. Um, while it is natural for us to feel excited and pride in our patients' accomplishments, It's important to exercise restraint in showing excessive emotion. By maintaining a calm and composed demeanor, we uphold cultural norms, create a supportive atmosphere, and facilitate effective therapeutic interactions. For example, if I had a patient accomplishing a goal I had for him, I may not show too much emotion because it could make them feel a little uncomfortable. Instead, verbal communication, like well done, would be more appropriate. For example, again, if I'm working at a post-acute facility and the patient is accomplished a goal that you had for him, sometimes we want to be like, well, okay, good job, like be very excited. Um, because we feel like it's they're gaining their goals, they're going towards independence, it's good for them, and we get excited for it too. So we might want to show emotion, but in Japanese culture, it is better to be play down the emotions a little bit and maybe just do verbal communication. You could be like, "That was a very good job," um, instead of being too emotional. Okay. Next thing I want to talk about is sorry, body position and feet. So um, let's discuss the significance of body position and feet in Japanese culture. In Japan, certain behaviors related to feet are considered impolite, such as exposing the soles of your feet or using them to move objects. Maybe you want to push a chair, right? Or directing them towards someone. You don't want to point your feet towards anybody, or even have them like resting on furniture. Um, it can be considered impolite. So, to ensure cultural sensitivity in our interventions, we should be mindful of our own body and positions. Um, we want to make sure we know where our feet are facing. Um, for instance, when sitting in front of a patient, it would be a good idea to avoid lifting our feet excessively to prevent the soles from being visible. Some Japanese can take uh, this as almost like being rude and considerate. Um, so we want to make sure we don't lift our feet up too high so they can see the bottom of our soles. They might even, worst come to worst, they might even find it offensive, you know. So we want to make sure that we know how we're positioning our body. We want to make sure that we want to sit, we want to sit maybe like straight up with both feet planted on the ground. We don't want to be crossing our legs. Crossing your legs can lead to maybe them seeing the bottom of your soles, which would then be considered, uh, possibly be considered inappropriate for someone of in the Japanese culture. Uh, so simple adjustments are just like I said, avoiding crossing your feet can go a long way in demonstrating respect for their culture and creating a comfortable therapeutic environment. We want to make sure our patients are comfortable when we're working them. We want to make sure our patients feel respected. So we don't want to do things, even if they're like inadvertent things, that they might consider disrespectful. So, like I said, so the few things that I went over would be the counting. Remember, we do this is one, not this. But again, taking into account that this is more common with older Japanese demographic, younger Japanese demographic might actually do it this way. And then we also beckoning. Remember, we don't want to go like this. We prefer to go like this. Um, Expressing emotion. Remember, keep it low. Try not to express too much emotion. And then body positioning and feet. Try to avoid showing the bottom of your feet. And in conclusion, professional communication plays a pivotal role in the field of occupational therapy, and understanding cultural nuances is vital for delivering patient-centered care. By incorporating these behaviors when working with Japanese patients, from counting and gestures to beckoning and body position, we can foster trust, strengthen our therapeutic relationships, and contribute to positive outcomes. So let us embrace this cultural sensitivity as an integral part of our practice and continue to grow as compassionate and effective occupational therapy professionals. Thank you.